estimated 12 billion working days lost annually to depression and anxiety. Experts say organizations must prioritize mental health issues. Mental health in the workplace is indeed crucial for overall well-being and productivity. If, for example, I'm feeling depressed, will I be able to anchor this conversation smoothly and successfully? Or if any of my colleagues involved in this production behind the scene is battling one mental health issue or the other, can there be optimal performance from that staff? Indeed, identifying and mitigating psychosocial risks such as excessive workloads, job insecurity, and workplace harassment is essential. Welcome to 30 Minutes on NTA News 24. On this edition, we're beaming our focus on mental health, particularly in work environments. I'm Lydia Sampson. Our first report will reinforce why mental health management is crucial, especially in the workplace where stress and pressure can lead to significant challenges. Are Nigerians aware that a sound mental health is essential for individuals to cope with life's challenges? Stephen Wokolo, it is time you share your findings.
Mental health encompasses emotional, psychological, and social well-being. It affects how individuals think, feel, and act, influencing daily life, relationships, and decision-making. Prioritizing mental health is essential for overall wellness. Mental health is considered critical at every stage of life, and its management is crucial, especially in workplaces and other spheres of human endeavors. Mental health indeed affects how individuals think, feel, and act. It determines how people handle stress, relate with people, and make decisions as well as navigate challenges. The President, Association of Psychiatrists of Nigeria, Professor Taiwo Obindo, and a consultant psychiatrist, University of Abuja Teaching Hospital, Dr. Samuel Abba, give insights into what mental health is all about and why mental well-being is a concern.
When we talk about mental health, we actually say it is a state of well-being in which an individual is able to realize his potential, able to cope with what we may describe as normal stresses of life, and the person is able to work productively and effectively, and then is able to contribute to the society. If for any reason the individual is not able to attain these four levels of functioning, being able to attain or realize or get to the level of understanding what his potentials are, the person is not said to be mentally healthy. If the person is not able to cope with what we may describe as a normal stresses of life, normal stresses in life, the person is not said to be mentally healthy. If somebody is not working productively or fruitfully, the person cannot said to be mentally healthy. And of course, contributing to the community is also one of the criteria needed to ascertain that somebody is mentally healthy.
Mental health is your ability to recognize your potential, ability to contribute, having recognized your potential, contribute your quota to humanity at your best. So anything that tampers with it makes you unable to fulfill your destiny, to be able to contribute to the society, affects your mental health. So we're not talking about just the illness that people know as if as mental health is just pure madness. Madness is just one aspect of it. But the generality of it is anything that affects your capacity to function maximally and make your contribution at your place of work, in your family, in your place of worship, and wherever you are found. The encompassing of all this forms your mental health.
Dr. Ben Amodu also lent credence to the views espoused by these psychiatrists, stressing that the poor mental health can have various negative consequences, which include emotional distress, leading to anxiety, depression, mood swings, and loss of interest in activities and livelihood. This condition creates fatigue, insomnia, headache, or other stress-related conditions. They maintain that it also manifests socially to the extent that victims begin to have strained relationships, isolation, and difficulties in socializing.
The impact is what you see on the road now. The impact is what the report you get from the police. The impact is in the high rate of crime you get here and there. The impact is on people jumping into the lagoon and so many things you are seeing. And then those who are even staying by the roadside, they are homeless, they cannot afford. And these things are not resolving. So the government too should try in its social responsibility to try to go and get these people, keep them, and try to resolve these issues by either treating them, preventing these situations, trying to find them something to do, or put them like social program, where social welfare program where certain money will be budgeted and given to a certain family who don't have anything to do. Look at in the US. You drive through the roads, see a lot of people as if they are beggars and all this. It's part of these mental issues, which is generated as a result of things like this.
They are emphatic that mental health is crucial at every stage of life, ranging from childhood to adulthood, noting that it impacts directly on employees' productivity, engagement, overall work performance. They add that poor mental health can lead to burnout, inefficiency, and increased absenteeism. They therefore recommend a healthy workplace and work-life balance that supports employees' mental well-being, boosts morale, and helps employees cope with workplace pressure.
Yes, yes, at the stage at which you are no longer able to function effectively, your mental health is challenged. Now, the degree of challenge differs, and that's where we come in. If you notice you are not sleeping well, the way you used to sleep, you worry so much, and then you go to work, you can't do what you're supposed to do at work, you're already mentally challenged, but you are still functional a little. Now, it can progress to the point whereby you are no longer coordinated, you no longer talk effectively, and therefore you are no longer contributing well to the society, you become a nuisance. They will not say are mentally derailed. It is all mental derailment. The difference is the degree differs. So people look at mental illness as if it is the highest point whereby you cannot function again. No, that one is the extreme. But it begins from the lower point where you will discover that your capacity to function and be productive begins to reduce. And when that begins, your mental health is already challenged. If you attack it at that point, you get out of it. If you don't attack it at that point, it progresses to the point whereby we say this person has, in Nigerian terms, colo.
There are levels somebody gets to in which the thoughts, the way the person speaks, the way the person behaves, the way the person interacts with others are affected, then such person is said to have a mental health condition or a mental health disorder. So in our terrain, we look at anxiety disorders, which is fairly well common, depression, this is more some of them, and then psychotic disorders, that people see things, hear things, believe things that are not appropriate. Those ones are said to have mental health disorder. And this could happen in various domains, right from childhood to even women in pregnancy, women who recently delivered, and even generally, people can have mental health conditions.
As the world celebrates Mental Health Day, Federal Ministry of Health and other critical stakeholders acknowledged that awareness of mental health is growing in Nigeria, but the cultural stigma around discourages mental health discussions openly. They, however, say Nigerians are beginning to understand the significance of mental health, especially in relation to dealing with stress and life challenges. They canvass more education and advocacy to break the stereotypes and encourage people to seek help when the need arises.
We that are well today can be having problems tomorrow, so let us look at them with an eye of pity and then in the modern medicine, there's what we call antabus. Antabus is what can cause hallucination. If you are doing those things, if you go back to it, you will have a lot of hallucinations. But if you are ready to cooperate, once you start, you don't go into hallucination. The antabus can be used. But in the herbal area where I specialize, we also have a herbal antabus, which can help you to come out of those situations without issues. But you must have made up your mind to cooperate so that once you start the treatment, you will not go back.
You have the antidote.
Yes, of course.
Tell us.
Yes, we have. We have the antidote, which can be used. It does not have side effects. It does not cause any harm. And we give it to people. They can use it. And with cooperation over time, most of those things change.
They suggest regular exercise, adequate sleep, and a balanced diet while avoiding overloads of responsibilities. Others recommend engagement in relaxation techniques such as meditation, breathing exercise, amongst others.
We need to increase budgetary allocation to health and by implication mental health. As we stand, only 3% of the provision for health goes to mental health, and a chunk of that goes to federal neuropsychiatric. So we need to improve that. We need to also create more awareness of mental health that people should know, because if they know more, then they would stigmatize less.
As part of efforts to mitigate the adverse impacts of mental health, they urged organizations to maintain a supportive environment that will reduce absenteeism and remote work options.
Everywhere, even in the household where you are married, the same thing. Even when you are self-employed, the same thing. What I'm recommending, you either take the medical antabus or you take the herbal antabus, which is a combo, a combination of some products that has the capacity to calm the brain and moderate the brain and pipe low the hyperactivity, as the case may be, and suppress a lot of those negative thoughts.
Tackling mental health effectively in the workplace, they believe, will lead to a saner society, a more productive, motivated, and healthier workforce.
Thanks, Stephen. And moving on now, how can organizations implement strategies such as mental health days, flexible work arrangement, and access to counseling services? Is it true that if these initiatives are in place, they will not only support employees, but also contribute to a healthier workplace culture? Thomas Ogbetere has all the answers.
Celebrating World Mental Health Day is critically a reminder of the importance of mental health. No wonder most organizations are increasingly recognizing the importance of mental well-being. As expert advocates, the implementation of innovative strategies towards creating a supportive environment and mental health initiatives. These experts believe will not only benefit employees, but also create a healthier workplace culture.
Health issues are very common in the workplace because in every workplace you have human beings there, and those human beings interact. And in the process of interaction, if the interaction is toxic or friendly or conducive, it has an impact on our emotional well-being, which is also our mental health. Let's remember that when we talk about health, as defined by the WHO, which is the World Health Organization, it is a state of complete physical, mental, and social well-being. So there are three components of health: the physical component, which we are all familiar with, the mental component, as well as the social component. So you can't deal with human beings and not take into consideration the three components of health: physical, mental, and social. The physical, we don't need to waste time about that, but the mental and social are very much influenced by what is going on in your work environment. Most of us spend a minimum of 8 hours at work every day. And so what goes on there, how you relate with other people in the work environment, plays an important role in your mental as well as social well-being. And we know from research that up to 20 to 40% of individuals in the workplace at any point in time will experience a mental health problem. So how do we recognize this? How do we address this? That is why the World Health Organization has chosen for this year the theme of the World Mental Health Day, which is 10th of October every year, is mental health in the workplace, just to bring attention to this very important aspect and to help create awareness and motivate people to pay attention to it and try to promote good mental health in the workplace.
So the common mental health problems that affect people are also the common mental health problem you find in the workplace, because that's where most people are. And what are these common mental health problems? They are anxiety, depression, and suicidality. Those are the common mental health problems that affect people. And because people spend most of their time in the workplace is actually a potential setting for identification and intervention and prevention of mental health problems. So if we do something in the workplace about mental health, we will have covered a significant number of people, because a significant number of people spend their time in the workplace.
Experts reiterate that introducing mental health days, flexible work schedules and arrangements, as well as access to counseling services, are some of the suggested strategies organizations must adopt. These initiatives will accordingly support employees in managing their mental health and create a more robust and productive workforce.
Right. So, but then what is mostly common that we are seeing lately is the burden of the tax that is being given to some of the employers to deliver on, and then again we see that there is a short time frame. There's also a pressure of the huge deliverables, that is expected of these employers. And then again, you will find out that some of those employers, they are not involved in matters that concerns them. So the communication in terms of activities that is happening in the workplace, they are not carried along. They're not.
So mental health in the workplace is not just about the absence of mental illnesses, but also how mentally resilient are your employees, how is their work-life balance, is their environment toxic, or is it a place that encourages them to, express themselves and just find help when they need it. So things around that. But mental health workplace is something that's very largely overlooked, both in the formal and informal sectors, especially in Nigeria. So I'm very glad that the World Mental Health Day theme is focused on workplace mental health at this time.
They acknowledge that creating an open culture around mental health in the workplace is crucial for a supportive environment where employees feel safe discussing their challenges. This begins with leadership modeling vulnerability and openness, encouraging team members to share their experiences without fear of judgment, discrimination, or repercussion.
Okay, some of the strategies that can really help in terms of enhancing mental well-being in the workplace will be awareness. So the first is people need to know about mental health. People need to know that there is nothing like being shamified because of their status of mental health. People should know that mental health is it's a health condition. It's health, right? So it's not something spiritual. It's not something diabolic. It's not something that they should be ashamed of. It's something that they should feel very comfortable to talk about, right? And then that should mean that there should be openness. Okay, there should be platforms or workplaces should be a platform where people should feel free to talk about their mental health, either to their supervisors or to their fellow colleagues or to their bosses.
Telephony line where people that are experiencing maybe traumatic issues in their private lives or in their family that does not even have anything to do with work. But the problem is that person, whatever is happening with that person, it will bring you to the workplace. And the workplace may not want to be bogged down by whatever that thing is. Can somebody now be able to call someone on a toll-free line, discuss that issue privately without even the knowledge of the employer? And this can be used to address basic mental health issues that people face.
On the Nigerian Mental Health website, that's www.nigerianmentalhealth.org, we have a directory of helplines. So if at any time you feel that you need to talk to someone, things are getting really overwhelming, your mental health is in disarray, it would be good to just visit our website, and then you'll find, help for whatever it is that you need.
They also advocated the need for training for managers, essentially in looking out for stress and signs of depression or anxiety, by equipping management to go an extra mile to recognize warning signs or distress and provide appropriate support. Organizations will create a more empathic workplace. Managers must also learn to have sensitive conversation, listen actively, and guide employees towards available resources such as counseling services or employees assistance programs.
We should remember that we have a law, the Mental Health Act of 2021 in Nigeria, and that law enshrines that no human being, no Nigerian citizen should be discriminated upon on the grounds of having a mental health challenge. So the issue of dismissing people when they have mental health challenges is discrimination, workplace discrimination, and has no place in law. It's illegal and should be stopped. We all should be our brother's keeper. So if we look at it this way, it's like having somebody with diabetes and say, oh, you have diabetes, I sack you. That doesn't make any sense. If you have diabetes and you're on treatment, you get better and you function well. If you have schizophrenia or any mental illness and you're on treatment, you'll get well and you'll be fine.
They insist it is vital to change the misconception that seeking help is a sign of weakness. This can be achieved through awareness campaigns, workshops, and sharing stories from employees who have successfully navigated mental health challenges. Normalizing these conversations will go a long way in reducing stigma, making it easier for individuals to seek help when needed. By prioritizing mental health, they emphasize organizations not only enhance employees' well-being, but also improve overall productivity and morale.
You know that you have a mental health or emotional well-being challenge, you should immediately consult a mental health professional. Ensure that you get the right treatment, okay, so that you can get well and get back on your feet as quickly as possible. This is very, very important, and management should be supportive.
Mental health issues are very common. In fact, the latest statistics is saying that 1 out of every 8 adults in Nigeria is either having, will have had, or will have a mental health problem. So that is something that is so widespread that it is in our own best interest that we don't stigmatize it.
But when again you notice any of the red flags, maybe there are issues around your sleep patterns or eating patterns, you're feeling guilty, you're always wanting to be isolated, you're always not wanting to enjoy what you have previously always enjoyed, it is now very important that or you're already losing focus, it's hard for you to concentrate, it's hard for you to commit to your work. You see that what you can deliver before as a deliverable in a day, now it's taking you a week to deliver on such tasks at the workplace. It's very important that if such red flags are seen, or you're always feeling guilty in the work, you're always feeling, it's very important that you talk to somebody.
Experts also say a supportive workplace culture not only helps employees feel valued, but also contribute to higher retention rates and overall job satisfaction. Therefore, they urge Nigerians to speak up or consult a professional whenever they feel depressed, either at workplace or generally anywhere.
And talking to a mental health professional will go a very, very long way in helping. Setting good work-life balance can go a very, very long way in helping. And then learning how to set good boundaries as well with regards to work can go a very, very long way. Sometimes people spend as much as 8 hours, your boss says go home, and then you're still in the office working, Or sometimes, due to the nature of your work, you overextend, or due to, demands from your employer, you overextend and all of that. But sometimes it's okay to say no. I know that it's something that's not very, common in Nigeria. Say, oh, to your boss, I'm sorry, I can't handle this at this particular point in time. But sometimes it's okay to do that.
Experts are unanimous that as the world focuses on mental health, it's vital to remember that supporting mental health in the workplace is a shared responsibility. Indeed, a productive workforce with more resources and support can be a reality for all if mental health is genuinely prioritized.
Now you see why employers must foster a culture that encourages open conversation about mental health. These experts say includes training managers to recognize signs of distress and providing resources like employee assistance programs. Everyone from leadership to employees play a role in promoting mental health. By working together, organizations can create a safe environment where employees feel valued and supported, ultimately enhancing both individual well-being and organizational productivity. Prioritizing mental health not only benefits employees but also contributes to a healthier society. Stay blessed and remain mentally healthy. Until next time, bye for now.